Hello students, today I'm talking about respiration, which is essential nursing knowledge. You'll remember about inspiration and expiration. So inspiration is when our diaphragm and the intercostal muscles contract and we have symmetrical chest wall expansion. Then when we're thinking about expiration or breathing out, the diaphragm and intercostal muscles relax and then the chest wall returns to the resting position. If we're going to live to be 70 years of age, we will have taken 600 million breaths. Isn't that amazing? Of course, we want to understand about breathing mechanisms and gas exchange. I guess they're the two most important elements for nursing care. And we really want to think about what is the normal range for breathing for an adult. And this is 10 to 19 breaths per minute. 10 to 19 breaths per minute. If we have outside normal, then we might have dyspnea, which is difficulty breathing. We might have bradypnea, which is slow breathing, so that would be less than 10 breaths per minute. Or we might have tachypnea, which is more than 20 breaths per minute. There are so many different influences that happen on breathing. We can have different things like exercise and pain. That is a very clear thing. So exercise, of course, when you are running, you are going to breathe faster, and you might even change positions. You might stretch out your chest. You might get in the tripod position to make sure you've got as much gas going in and out of your lungs as you can possibly move. When we're thinking if someone is in pain, you might find that they barely move at all, or they do really huffy puffy kind of breaths, and that's how it can also be different. When people have anxiety, they might also breathe very quickly. So someone who's presenting to a hospital worried about something, you might notice changes in their breathing. If people are smoking, this can impact how much gas is being exchanged, and so they might need to breathe more quickly to move the same amount of oxygen and carbon dioxide. Medications can also change your respiratory rate, as can having a head injury, and also if someone has hemoglobin function, or think about the hemoglobin in their red blood cells and the exchange of gas there. So if you haven't got as much hemoglobin as would be within normal limits, you might find that someone will need to breathe more quickly to move the same amount of oxygen around the body. Normal breathing is relaxed, regular, automatic, and very quiet or silent. If you tell a patient that you are counting their breathing, what do you think happens? They start breathing like this. So it's a really recommended thing to just do the quiet, observed method, that you are going to be discreet, and you are going to pretend that you're still counting someone's pulse rate while you also count their breathing for a minute. You can also position your patient so that you can notice the breathing rate. So you might want to put their hand over their arm like this, or you can just notice how a button moves or something or other like that. That can also help you. So the initial assessment, you need to count breathing for 1 minute, and after that, if you start to know the person, then just over 30 seconds is okay, and then obviously times by 2. You do want to look for breaths per minute. You want to think about the ratio of someone's heart rate to respiratory rate, like how is that working? So you'll take someone's pulse rate and then compare that with the respiratory rate. You also want to think about effort, amount, tempo, and hue. So hue means what colour is the person? Are they looking cyanotic, which is a kind of an element of blue? Do they have cyanosis? Or are they very florid? Do they have a reddish tinge to their skin? How do we assess, or what else do we assess? These are some definitions that we also want to add to our vocabulary. So in ancient Greece, pnea, so pnea, like that, P-N-O-E-A with the silent P, meant breathing. So hopefully this will help you to understand where all these words come from. So dyspnea, as I said before, is shortness of breath. Tachypnea is when someone is breathing faster than 20 breaths per minute. Bradypnea is when someone is breathing slowly. We also have hypopnea, where someone is breathing abnormally deep and rapid breathing. So it's going to be deep and also rapid. Apnea is when someone has stopped breathing or absence of breathing. We can have hyperventilation, when someone is breathing very quickly, and it can be also deeply or also shallowly. And hypoventilation means that someone is not breathing enough. Also, orthopnea is an interesting one. So this is when a patient must position themselves, when it makes a difference to help them breathe comfortably. So they might want to sit in a recliner or sitting leaning forward with arms supported on a pillow, because the position really makes a difference in how they can breathe. So that's all for the respiratory mini lecture today. Thank you for watching.